People have 30 minutes waiting for the session, so they have been patient. Good morning. Welcome again for the third day of the Social Innovation House. And today is a very special day because we are going to present our first report in mental health and public policy. And I have with me the incredible Balasubramanian and Daisy Rosales, the authors of the report. And why mental health is so important. I'm going to tell you a little bit story. When I started working in this sector, probably 10 years ago, with mental health, it was around 400 million people with depression and anxiety in the world. This year, the number rise to 970 million people that live with anxiety, depression, and many other mental illness. So it's something that is increasing and it's affecting everything in our life. So we are very happy to have you here and to have the opportunity to present this report in Davos. So Daisy, I want to invite you to tell us a little bit more about your experience in mental health, which I know is huge, and also your role as a co-chair of the Mental Health Collaboration in Catalyst Now.
Thank you so much, Gaby, and it's great to be here with everyone. So 6 years ago, I started an organization that was focused on working with civil society leaders and communities to integrate mental health into everyday life. And let's start with the fact that, yes, mental illness is a serious concern, and we know now from a research study from Harvard and the University of Queensland that 1 in 2 people globally are expected to experience poor mental health at some point in their lives. And we know this intuitively and experientially. I've been on my own mental health journey, and so I believe that this is really for everyone, wherever they are on the mental health spectrum today. And so our partnerships with local organizations and leaders seek to integrate and strengthen mental health in communities that are experiencing poverty, injustice, marginalization. And then increasingly, those programs are being integrated into the broader ecosystems in which they work, whether it's education, gender equity, health, et cetera. And so what I love about the mental health collaboration at Catalyst Now is that we are a really diverse group. There's over 130 social entrepreneurs and leaders in mental health within our collaboration itself. And I love that Catalyst really stands by practitioners, Gaby. I think, there's so many people that can talk about what should be done, whether they are people in power, political leaders, funders, academics, et cetera. But the Catalyst Now groups really represent the practitioner's perspective. They are on the ground with communities, seeing healing happen, seeing what really works. And so we want to represent that perspective, especially in mental health, because as you said, the scale of global need is enormous.
Indeed. Thank you so much, Daisy. So can you tell me a little bit more about how this report connect with your own well-being journey and your own professional experience?
Yeah, thank you so much, Gaby, and thanks to Catalyst as well for having us here and for hosting us. We're really grateful to be able to share our report and for everyone else that's here as well. My own journey has been a little bit eclectic, quite honestly. I studied engineering in my undergrad. I was a Peace Corps volunteer, went to business school and studied marketing, worked in the private sector for a while, and then came back to international development in about 2010 and have spent over a decade working in development, specifically in social marketing, and with a few different international NGOs, working with human-centered design and design thinking approaches, really working together with the communities to design solutions. And my most recent organization I worked with was specifically focused on global health, and so we were working in HIV and sexual reproductive health and a host of different other health areas. And one story specifically that really helped me see the need for mental health to be integrated into broader health work, was when I was in Southern Africa working with a specific community where we were building a program for adolescent girls. And one of the girls came up to us and said, I was raped by my teacher yesterday. And and I don't know what to do, you know? And so our response, being a health organization, was to say, well, let's take you to our local clinic. We'll give you a emergency contraceptive, and here's a post-exposure prophylaxis to prevent HIV, because we were in a country where the prevalence of HIV was 25%. And, you know, it just struck me then over and over again, these kinds of stories came to us that this girl, while we were treating her mental health or her physical health, we were completely neglecting her mental health. The trauma and, you know, the aftermath of that experience were just nowhere to be found. And so for me, the longer I kept working in that space, it felt more irresponsible for me personally to continue that work without thinking about how do we be much more holistic, much more integrated in our approach when we look at global health, to say how do we look at mental health part and parcel with physical health. And so that actually led me to go back to school in my 40s, and I got my master's in social work. I'm now practicing as a psychotherapist in Washington, D.C., where I'm really looking to start. My passion really now is to how can I put those pieces together so that I can work with other international organizations that are really interested in integrating mental health. So it was very fortuitous when Daisy came to me last year and say, hey, I'm working on this report. I'm thinking about, you know, starting this report on integration. Would you want to join me? So I was very grateful that all happened, and here we are today.
What you are mentioning now is very common. You know, we used to work isolated, you know, social entrepreneurs on a side, governments on a side, private companies on the side, and many things that we are not seeing, and are many things that we are neglecting because we are just focused on our own area. But this report is about collaboration, which is the focus of Catalyst now. We are here to promote cross-sector collaboration and understand that that could work is something amazing. You know, a lot of people don't believe that could be a real collaboration impacting with social entrepreneurs, with governments, and you have a bunch of case studies around the world that prove that. So I want to know a little bit more about the insights of this report, you know, what you learn, what are the keys, you know, when you found, what happened when social innovators collaborate with governments.
Yeah, I think I'll first say also, Gaby, that you know, when social innovators start an initiative, there's this narrative that you got to nail it and scale it, right? Like get it really right, and then get someone else to do it, and then you get to exit or move on to your next thing. And you know, I've heard that narrative over and over again, starting Brio, and I was like, this feels like a punchline and not a process. It's not answering the real question of how do we make change and how do we make it together with communities and with other stakeholders, so that, you know, thinking about these millions of people who are struggling, they'll actually encounter some mental health support in their everyday life, and you've got to involve the public sector in that. And so what we started with was this idea of like, okay, so, you know, there's this idea that you create an innovation and then you get it integrated somehow. But what emerged once we interviewed our 7 different case studies of real life social entrepreneurs and civil society organizations who are currently working with governments, and this is from the local, hyper-local city level all the way to the national level. And so, you know, a really wide range of types of collaborations. What are some of the heuristics that kind of emerged from this, you know, how they've collaborated, what that process looks like? And so what came out of that was a little framework that we put together called Innovate, Integrate, and Sustain. And so these are 3 different phases. It's non-linear. Organizations and collaborations can kind of like move across this triangle, if you can kind of visualize it. And so we're happy to kind of share a little bit about each phase.
Perfect. Tell us more. And tell us also, I know from my own experience, it's not easy to collaborate with governments. You know, it's a different pace. It's a lot of things that you need to sort before starting a collaboration with a government. But why is it important to have a collaboration with governments? Why the public sector? What you found in the report, in the research that you did, that can give us, you know, that push to understand that we need to make the pace and collaborate with governments?
Yeah, I think this is a great question, Gabby. I think there's a few different ways to think about this. The first is, the government has the infrastructure to scale, where you've got innovators out there that really come with the insights, they come with the precision that neither can do alone, but together they can actually bring these transformative solutions to scale. And I think that that's one of the key components here. And we've seen some great examples in the report where this has happened, in Nigeria. The Getty Foundation really came together with the government, and they really took ownership of the Mental Health Act, which is now, fully embedded in their government policies, their national policies, and that now allows people within Nigeria to have full access to mental health services, and it requires the government to provide those services. And that started smaller with these innovations from the foundation. And so I think that is one very key component. I think also, when we think from a practical perspective, governments also, when NGOs exit, they're perfectly positioned to be able to enact policies. They're very positioned to be able to have accountability mechanisms. And they're also, in this really great place to take these initiatives to scale in that way, because they can allocate the resources that they need to. And so from that perspective, there's ways that innovators and governments can really work together to bring all of these great initiatives that could start small and iterate over time to scale.
As I say, it's not easy, and you found some best practices in this report and things that the social innovator did in the journey to collaborate with the government. Can you tell us a little bit more about what you found?
Yeah, sure. So what Sue and I did was we interviewed 7 different teams about their work with the government. And in some cases, they were actually employed by the government, and we interviewed them about their work with a partner nonprofit. So we did both of those. And we made a list of, these are like some common practices and themes that we're noticing that all of them did to some degree. And so there are 10 of those practices in the report. We won't regale you with all of them right now. But one of them is actually aligning on something other than incentives. We like to talk about sticks and carrots. Institutions are really good at sticks and carrots, or incentives and punishments, or consequences, let's say. But what social innovators and civil society can do is bring the value, the vision, the mission, the commitment to community, because that is what drives them. They all have mission statements. They all have a sense of broader social impact and purpose. And so when they bring that to a space with the government and they share, like, okay, what are some of the things that we all care about? What would make this worthwhile? What would it look like to serve our citizens in a way that we're proud of? I think what we've seen with some of these partners is that they actually have that conversation very concretely from the beginning. They say, what are some of our shared values? Is it courage? Is it harmony? Is it truth-telling? Is it justice? And they'll actually name those values. My organization, Brio, partners with an incredible partner in Rajasthan, India. And when we first started working with the education department, that's actually what they did. They sat down and said, what would make this worthwhile? And what that turns into is intrinsic motivation. And so when all of the extrinsic stuff fails to bring people together, it's the intrinsic sense that we care about this. I care about this personally. I'll just say that the way it shows up is really moving, especially because mental health is so personal and puts people in a vulnerable place. Back when we were launching a pilot of a curriculum we designed that's now going across the entire state, one of the division leaders actually went into chemotherapy. And so she was unwell for a long time. But she came to that launch with 120 teachers, and she said, I'm here today because of this work. It has saved my life. And so I think that when, it's possible when you connect with government leaders on a human level, that really sustains the collaboration in a way that that I think social innovators are poised to do.
Yeah, and if I could just add, to what Daisy shared as well, there's another best practice that I just want to highlight as well because it's one of my favorites. And it speaks to my heart as somebody who loves, who's analytical at heart, is advocating with evidence. And this is something that, governments respond to evidence. And if we can come to them with the right balance of quantitative data plus qualitative data, bringing stories from the ground, from the people who are actually experiencing, the challenges on a day-to-day level, that combination can really create a very compelling case for action, and we've seen that happen. Even sorry to use the same case study example, but even in Nigeria, the Getty Foundation was able to show the government this great, it's not great, but this connection between depression and the prevalent and HIV with people living with HIV, and both being able to share stories from the ground. When you think about folks living with HIV, when the level of depression that they often face then makes it harder, creates a barrier for them to continue moving forward, to take their antiretroviral therapy. And then, that creates even further complication in their illness. And so being able to support them through their depression journey shows better health outcomes for them as well. And so that really that was a critical component in the Getty Foundation, being able to work with the government to include mental health access in their national HIV strategy. And so that was such a great use of data and a way that they have found that they can continue to advocate in that way as well.
I want to give the opportunity to our audience to make some questions, but first I have a question that is burning in my mind. You found case studies in different countries, and governments are different around the world. It's not the same to deal with a government in Latin America, Asia, Africa, or Europe, or even US. What you found, is similar to work with government. There are key elements that we need to take in consideration. There are certain countries where it's easier. How you saw in the examples, because you have case studies from around the world, what you saw in the examples that could be something that we can give to the social innovators to take the step and say, okay, I'm going to try to work with my government, even if it's not very collaborative.
Yeah, so I think this is also an excellent question, because this is a constant struggle, right? Where when we think about scale and we think about tailoring for specific contexts, there's never a cookie cutter approach. It's not one size fits all in any way, but it's finding the balance, or what are some of the key themes that we see are appropriate, and then how do we make sure that these lessons are flexible and adaptable enough for social innovators to then, and governments to then take them and say, how do we apply this to our local context? Knowing that our context, even if it's in the same country, from one region to the next, it might be totally different, right? If you are looking at local government to local government, if you're looking at national government to local government, even that can be different. And so I think it's that finding that right balance between how do we make sure that we're looking at the overall umbrella of key practices, but then also allowing room for that tailoring. I don't know if Daisy wanted to add anything else.
Yeah, that's great. I think one of the things that we also found is, on the other side of integration, which is when you are working really hard to match or to codify what you've co-created with the community and with the government into the government system, right? And so the energy changes, and you're institutionalizing. I think on the other side of that, the nonprofit or the civil society organization doesn't exit. They go into this sustaining phase where they continue to be a thought leader, ideally, or a continual innovator, where they are continuing to provide feedback and support to the government in implementation. And so when we think about these partnerships, I think it's not necessarily saying that, it will really just be one day you're washing your hands clean and you're going out and it's going on, perfectly forever and ever. I mean, we know that life is just so dynamic. In a few years, the world will be different. But I think in those moments, what social innovators have done is they've leveraged what they can by building individual relationships within the government. They know these key people really care, and they continue to correspond with those people, offer support where they can. And sometimes it just means, Sue and I were talking about this yesterday, if the government's not ready to co-create with you, which is like really ideal, maybe they start with saying, okay, like let's have you come and do this training with our staff, or let's have you come and work in this one school or this one district, and we'll kind of keep an eye on you and see how it goes. And it doesn't always go somewhere, but I think what happens when organizations continue to show up and say, look, the community wants this, they are excited about this. If you do this, it will look great for you. You will be serving your citizens better. And I think at the end of the day, that strengthens civic engagement. It strengthens sort of people's perceptions of their government's ability to serve them. And, that can certainly be an encouragement to the leaders, but it takes time.
And it also, that approach also builds trust between the local governments and the innovators as well, in that they're able to show that transparency of, here's what we're doing. It's not, we're doing this behind closed doors and we'll just write a report to let you know how it goes. It's, another one of the key lessons learned is really inviting the government in and allowing them to really experience the intervention. And so they, they gain this sense of appreciation for what this intervention is, and they see the community members asking for it, right? And because hopefully you've co-created those interventions with the community, you're hearing those challenges and those needs from them as well. And so the more you can engage the government in those early days from the beginning, I think the more successful you can be in that collaboration with the government.
100%. Thank you so much. This is very exciting. It's the first time for us on Catalyst now that we are launching a report in several languages at the same time. It was a pleasure to work with you, ladies, in put together this report. And the reason why we're launching this report in 6 languages at the same time is because we know that our social entrepreneurs and our local leaders want to collaborate with their governments, and the report is full of insights. Of course, it's incredible for people working in mental health, but even for people that is working in other areas, if you want to collaborate with a government, you need to read this report. I read it, and I was like, oh my God, that's true. How I didn't think about that. There's full of insight and full of learning. So I really recommend it. You can download it in our website, socialinnovationhouse.net, and soon in catalystnow.net. But now I'm going to open the floor to our audience because I know you have questions for our panelists. So over to you.
Thanks so much. I can't wait to read the report. I've got 2 questions, actually. So you talked about the 10 things that are common that people do in successful innovations. I'd love to know what those are, just the highlights. I know we don't want to go through all 10, but the ones that you think are most important or that were coming up the most. And then my second question is, what surprised you, in the report? Did you really discover something that you really weren't expecting?
Yeah, I think to your first question, there's a few that we noted. There's the really advocating with evidence, the making sure that you have shared values to build trust within partnerships. Some of them are a little bit more tactical, like how are we creating written, what do we call them? Like MOUs or specific partnership documents with organizations. It's allowing governments to experience the interventions, as we talked about as well. Those are some of the key ones that really stood out to me, and allowed Daisy to talk about some of the ones that stood out for her as well. And to answer your second question, I think one of the surprises for me was just how much there was in common across all of these case studies. I mean, we really did. We're big believers, that you really have to have mental health interventions and solutions that reflect the populations that we're serving. And so, we published, as Gaby said, in a lot of different languages, but our case studies are across geographies, across sectors. So we wanted to be across different contexts and several different continents as well. And even across all of that, there were so many of these best practices that really, like, when we synthesized our insights, came up as commonalities. So I think for me, that was one of the biggest surprises. Thank you so much for that question.
Yeah, I think one of the additional practices that stood out to me was leveraging constituent buy-in and community advocacy. There's an example in Costa Rica where it's actually networks of men who want to work on their emotional and mental health. And they actually form their own collective, and they go to the municipalities where they live and they say, we want this program here. Can you make it happen? And so I think being able to bring people together and say, again, this is what your citizens want. This is helping the population. That's very motivating. Governments want to serve the people, and they want to serve them in a way that people will be excited and grateful to continue to participate and engage in civil society. So I think that was a big piece of it. And I think that, it was also my surprise. It was, one of the things where, again, when we see the government as just this punchline, as this is the system that we're going to stick stuff into, and then, go to scale and call it a day. What you miss is actually the way that it comes back to strengthen civil society as well. I think, there's this idea that nonprofits take risk capital, as philanthropic capital, to innovate in the social space and then look for ways to exit. But I think it's so much more than that. It becomes a way in which citizens become connected to their local government. They become connected to the ways in which their state can serve them. And so that was a surprise to me. In the United States example, I actually came off of that call and I thought, wow, democracy works sometimes. So I was really thrilled to see that.
Thank you. We have another question here.
Yes. Hi. I want to know a little bit more about best practices, especially in mental health. Not just the collaboration, but in the terms of mental health, what ideas or good practices did you saw that maybe to another entrepreneurs around the world that they are not focused in mental health, but they can use some of those tools with the community we can use?
One of the things that I found really fascinating, one of our examples was from Basic Needs in Kenya. And what they really did was think about how do we integrate mental health across a whole lot of different parts of our own government and how we serve our population. So they looked at livelihoods and how do we actually build programs to help to combat poverty and give economic empowerment and also integrate mental health into those programs. How do we look at our schools and how do we integrate mental health into the curriculum? And they did this across several different government organizations, and it was a fascinating case study because it wasn't just one organization within the government that they worked with. They had to be very flexible and work amongst different organizations. And so I think really thinking about holistically, looking at mental health as part of somebody's well-being, not just a part of their health. I mean, obviously we use the term mental health, but it is across somebody's well-being, whether it's their financial well-being, whether their physical well-being, their emotional well-being, their spiritual well-being. There's so many ways to think about it.
Thank you so much, Daisy and Sue. We are running out of time. Thank you for being with us here in Davos, and also thank you to the audience connected. I want to invite everyone again to download the report in socialinnovationhouse.net. We are very happy to have you here and very pleased to present this report together. Thank you so much.
Thanks so much. Yeah.
Well done, guys. Thank you for your questions. Thank you so much.